Since this is the newborn, the first thing that we will have to do is to determine the AFGAR score. AFGAR is a quick test done at the 1 minute and the 5 minutes after birth. The only whole minutes it would tell us and how will the baby tolerated the birthing process. And the AFGAR score 5 minutes would tell us and how will the baby is doing outside the mother womb. And now for the return demo, let's say that the baby has the APGAR score of 3, which will falls within the consuming the range of the means that the baby is a need for the immediate resuscitation. So after determining the baby's APGAR score, we will have to simulate the baby response through tapping the baby's shoulders, rubbing the soles of the feet, and calling the babies out loud. Baby, baby, can you hear me? Baby, baby, can you hear me? Baby, baby, can you hear me? So after doing that, the baby is still no response. We will have to call out cold blue or doctor squeak, and so that the doctors and the nurses could come over and help us to revive the baby. And so what we'll have to do next is to open the baby's airways. We'll have to sanction the baby's mouth and nose, and using the suction bulbs with the remove the secretions there is or any obstacles of the baby's airway. So after that, we also do the head tilt and chin left to open the baby's airway. And since the baby did not respond to that stimulus that we did, we have to perform the positive pressure ventilation. There are the two types of positive pressure ventilation or PPV. It could be through the invasive, which is through use of the ventilator, or the non-invasive one, which is the through that use of the pediatric bag mask. I am going to use the bag mask. What I'm going to do is to cover the baby's mouth and nose with it. So now hand position would be the thumb of the forefinger at the hands at the one hand and the place at the rim of the bag, and bag mask to ensure the pressure seal of the remaining fingers will be placed of the jawline of the baby, and this is done for that our hands not leaning at the patient's eye and not compressing the baby's neck and support the baby's head. So we'll be delivering the oxygens of the baby to sure to maintain the proper facing. So that what we're going to do is breathe 2 3, breathe 2 3, breathe 2 3, breathe 2 3. So the PPB should be done for the at least 30 seconds of the rates of 40 to 60 breath per minute. So look for the chest rise of the each kanang bigging and after doing that, someone will be attaching the heart monitor to the baby and a pulse oximeter to keep track the baby's heart and rhythm, and to measure the hemoglobin, oxygen, and saturation. It will help us to monitor the efficacy of CPR. So if there is no increased heart rate, the performing the PPV will have to proceed the chest compression. So since the babies will have to use the 2 to 3 fingers or 2 thumbs technique and place the compression fingers at the center of the chest just below the nipple, and 3 chest compression and 2 risky breath, and chest compression would be the dip of 1 inch only, and since there are the bones isn't strong enough to handle and immediate pressure. And now I am going to begin the chest compression. 1 2 3 4 5 6 7 8 9 10 11 12 30, 40, 50, 60, 70, 80, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And give 2 rescue breath. After doing the CPR, if there is still no increase of the heart rate, we will have to continue doing the CPR and prepare to assist the incubation and giving meds. So, if the babies increase the heart rate after the compression, then we can proceed the post-resuscitation. After doing the CPR, if there is still no increase of the heart rate, we'll have to continue doing the CPR and prepare the assist of incubation and giving meds. And if the babies increase the heart rate after the compression, then we can proceed the post-resuscitative care. We could find there the procedure and at least done we needs to be done, and to ensure that the baby's doing fine and the baby's body system are working fine. And after doing the procedure, we'll have to document the time, procedure, assessment, and response to the treatment and medications given.